Welcome to the Valor Flight Crew podcast, hosted by Echo and brought to you by Vertical Helicasts and Vertical Valor magazine. In this episode, we're diving into the mindset of the Resuscitationist and what it takes to perform under pressure when every second counts. This week, we are joined by Dr. Garrett Cavaliere as we explore how preparation, teamwork, and self-awareness shape outcomes in high-stress environments like flight medicine. We'll talk about managing stress responses, the impact of fatigue, the power of mental rehearsal, and the value of debriefing after critical incidents. If you're in the business of saving lives under pressure, this conversation is one you won't want to miss. Throughout this episode, various studies and graphs are referenced by Dr. Cavaliere, so be sure to head over to our YouTube channel to get the full effect of this conversation. Thank you to our sponsors, Metro Aviation, Airbus, and Precision Aviation Group.
Welcome to the Valor Flight Crew podcast, brought to you by Vertical Helicasts and Vertical Valor magazine. Produced in partnership with Echo, Every Coast Helicopter Operations, the Valor Flight Crew podcast promotes the personnel and life-saving equipment behind helicopter air ambulance services. Join hosts Mike Fideli and Blake Schreider for in-depth interviews and expert insights from air medical personnel, pilots, communication specialists, and maintenance crews who play critical roles in airborne emergency response.
Line 1 accepting.
Copy, line 1, gotcha, accepting. You're going to be talking to Red Feather 1 on LCEMS.
I think obviously we've had a lot of discussions specifically surrounding resuscitationist and the mindset of the medical crew, but how do we apply this to the entire crew that's out there on a helicopter? Because this is not just about taking care of a patient. I feel like these concepts can be applied on a much higher level, or broader level, I should say, when you talk about the entire crew involving, our pilots, mechanics, comm specs, and of course medical crew then. But how do we apply that to the entire team concept? Because these are obviously things that everybody is feeling in those high stress environments.
So really that we start getting back into the techniques, and these techniques will transcend the medical crew, even our mechanics. When they're doing these high risk evolutions, they need to be equally as focused. They need to go through the same process that we would go through. And I'm going to bring up, it's called the 0-point survey. And this was originally designed by a doctor by the name of Cliff Reed, works for London HEMS. And this is for everyone. And part of the 0-point survey is to understand yourself and understand what you're going through. We do FRAX scores over at Penn State Health Hershey Lifeline. It's understanding what's going on with you. And they use a mnemonic with it. But really the big parts are illness, medications, stress, fatigue, and then eating and elimination. So whether you're a pilot about to do a multi-leg IFR flight or you're about to put one of our turbines back in, the same thing applies. Are you feeling sick? Whenever we're feeling sick, we're not at our best. You're not going to perform well. Are you on medications that might decrease your reaction time, decrease your ability to... And I'm not talking about drugs, alcohol, fitness for duty. That's a completely separate discussion. I'm not getting into that. That is, at this point, we shouldn't be doing that at all. If you recognize that, report it through your management structure.
Right.
That's a zero tolerance. But
right.
Are you on cardiac medications that might decrease your ability to increase that heart rate? Think about beta blockers. How often do we get on scene with hemorrhagic shock patients, or once you're dying in front of us, they're fine, their heart rate's 75. I'm like, they're on 150 of metoprolol. They shouldn't have a heart rate that's that high.
Right.
But how does that affect you and your performance? Right? Exactly. But how does that affect you and your performance?
Sure.
How is that going to affect how I accomplish my task? Same thing with fatigue. And fatigue is one of the biggest factors. And I'm super guilty of this, just being in a 24/72 fire service. We go until we get it done, and emergency medicine, because you tell me I got another job, I'm doing the job. I got another flight, I'm taking the flight. Hey, do you need to break from doing chest compressions? Nah, man, I'm good.
Right.
We've seen this in every part of this. Fatigue is a massive factor. So I like how some programs and some places will do reaction time. so you can quantitatively see how your reaction time is based on your fatigue level. And that was actually originally designed with Indy and Formula One after they had TPIs, where these drivers were like, nah, I'm good. So again,
Right.
same transcending, not just medical crews, but into.
Are you though?
Yeah.
And they're failing miserably, and it's like, so you want to be driving at 200 plus miles per hour on a street course, and you can't properly click the correct lit up number,
Right.
but you don't recognize it when you're that fatigued.
Right. Exactly.
Same thing with eating and elimination. I get hangry. My wife tells me I get hangry. I'm like, nah, I'm good, and I probably am hangry.
As I mentioned before, there's a reason that my partners carry emergency Scooby snacks with them, and it's not for them.
It's for you.
They throw me a Snickers every now and then. I totally get that. But yeah, I notice when there's those external stressors that like my anxiety level or my reaction time or my tolerance for things not going right significantly changes in those environments when I'm feeling any one of those other physical stressors that go along with it.
And what's interesting is when we're focusing on this piece, especially in terms of our flight crew and our crew resource management, you brought up our comm specs before. This is equally applicable to them. This is applicable to, it's even applicable to EVS, to our environmental services people, because if they're performing a task and they're not at their best, you're not going to perform at that high level of standards that we're used to.
Sure.
Now, does that mean you can't go to work? Oh no, I'm still going to work. I don't call off. COVID was super interesting in our environment when they're like, oh yeah, you can't go to work. And you're like, nah, I'm good. You're like, you have 102 fever and you can't breathe. I'm like, I can breathe well enough. We're going to work. So understanding your own limitations and when, hey, maybe it's not safe for me to go to work, or versus, I heard a joke the other day. It's like, oh yeah, it's kind of like when you have a temperature of like 100.2, so like 37.9, like not a real fever, but you probably don't feel great.
Right.
So understanding that self-reflection piece and having that own self-assessment and realization, I think, is incredibly important. And that's part of that 0-point survey.
And I think that also kind of like blends into the whole team aspect of it, you know, relating it back to, you know, doing our flight risk assessment stuff. Like that's on me personally, to be honest, not only with myself, but with my team of how I'm doing that day. Right. Like, you know, I think as a team, we can somewhat tend to compensate for each other in one way or another, but I need to have that personal awareness and understanding of where I'm at on that particular day. And that's what's hopefully going to help keep all of us in check by having that honest conversation. Doesn't mean they need to know everything that's going on in my life and why I'm throwing things down the hallway today, but you know, like it just means that they need to have that awareness of like, hey, he's not on his game. Like, and there have been plenty of days where I've looked at my partner and be like, you're totally carrying the team today because I got nothing in me, you know, and to have that self-awareness, I think, is sometimes half the battle. Because I think as long as you have that awareness and you can plan around going into situations where you know that you may not be on the top of your game, you can somewhat compensate for different things.
So I really think that's a great segue into the next part of the 0-part survey, which is team, and updating that plan and knowing that plan and describing that plan and communicating that plan with everyone. Because if you're not communicating with each other, you're not going to succeed. It's, I don't know, Blake, how much ICS experience do you have? Not to call you out. Totally.
Not a lot. You know, we go through the required training, you know, and then that's, you know, normally if we get to some type of larger scale incident, right? So like things have always transitioned. Now there's unified command, there's, you know, plain talk, you know, there's all these things that have kind of evolved. But when you get there, like if I'm getting there in a helicopter, there was way more people there before me that have already kind of decided, you know, how things are going to go. So really, my experience is you called, I'm here, just tell me where I need to go and what I need.
So you're asking for communication, right?
Yeah.
So where do all of these incidents, where does everything always break down?
Oh, communication.
Every single time.
Yeah.
So it's great when you get to the high level ICS stuff where you're in the management side And you go through all of these plug and play resource allocations, and you go through these massive incidents. And almost initially, every single time, you have communication breakdown with the first arriving units through the entire incident. When do we have resuscitations that fail miserably? There's some communication breakdown between either the team leader or the different pieces of the team. If you use micro teams, and the feedback loops, every single time, the failure point is usually communication. And that's where that team piece comes into this.
Yeah. And I feel like there's been so many situations that we get in, like if something doesn't go right and I'm sitting there and we're talking about things in the debriefing after that call, and how could we have done things better? I feel like that's always like the overarching theme that comes with it. That's one of the things that like frustrates me the most, is that when I'm trying to function in a high stress environment and lead that team, and we don't have good communication and we don't have good interaction with each other, because I almost feel like, from the team dynamics, if I'm in a high stress environment with my partner and there's 15 other people in the room, the one person's voice that I'm going to be in tune to is my partner, because that's the person that I know I can rely on, number one, and number two, that I need to be aware of everything that they're doing so that we're moving in the same direction together to get that patient from point A to point B. And when we don't have that and that sync is off, like it feels like it throws off the entire plan.
So, and part of that is also having that plan when you're going into it. So before you even got there, you talked about what your plan was going to be. You talked about anticipated drips, anticipated procedures, anticipated actions, and then ultimate goals. Yeah. So maintaining that constant loop and feedback of communication when things are going right, things are going right. I need a little bit more time. Hey, we're going to probably need 2 or 3 more other drips. Can we start prepping these? It's having that teamwork and that feedback that also helps to prevent these derailments. And a lot of this, and to cycle back to the whole part of why we're doing this podcast and human factors and breakdowns, communication is one of the biggest breakdowns. How do we prevent some of this? It's having that sense of self, really knowing, when am I in a good space? When am I not in a good space? Communicating with my team so they know when I'm in a good space or not good space. And then really discussing that plan. What are we going to do? What's going next? What do I anticipate? What do I think is going to go right? What do I think is going to go wrong? The last 2 parts of it are environment. So making sure that we're all safe. And like, if you're on the side of the cliff, you need to make sure that we're doing the right thing for the patient. Space, heating, lighting, anything you can control to really optimize that space around you. And the last is obviously the patient, where you need to kind of know what's going on with them. But understanding those variables and how those are going to perfect your own individual performance, I think is super important. I mean, and then just for like some spaced repetition and kind of bring us back to everything else, in these high stress environments, we're going to prepare ourselves for that high risk environment. Super early preparation is going to be that deliberate practice, right? We're going to deliberately practice. We're getting our procedures done. We're getting the different algorithms. We're getting our guidelines, because we don't use protocols. Protocols means I have to do it. Guidelines give us guardrails. Stay in the guardrails. We're good to go. So we understand what we're doing. We're about ready to go on scene. We're about ready to do a job. We're preparing for the day. We're going through that 0-point survey. So now we're ready for ourselves, our team, the environment, the patient. And then we're always maintaining that open communication. We need those lines of communication to be open with the team members.
Yeah, for sure. And I feel like it's, that team aspect as well as the self aspect. I feel like there are so many factors in there that are kind of like a use it or lose it kind of thing. Like if you don't practice that communication with your team, if you don't practice the skill set that's in front of you, if you don't practice the plan that you want to do as a team, like all of those things fade. And I think it happens pretty quickly. At least it seems to. Like there's just some days where it's just kind of the wheels fall off, and it's really hard to get it back on track.
They need to do an updated study on this, because it's one of my favorite graphs in medicine. And some of this is extrapolated from the academic medicine literature, since a lot of people look at skill degradation in flight programs. But a study from 2004 by Erkson et al. Published in the Journal of Academic Medicine, and you can put for the actual podcast, you can put the graph up for it. But so it looks at student, resident, specialist, general practitioner skill atrophy over time. And from 0 to 9 years of general practice, you have your students that are getting better. Residents, you're getting better. you graduate residency and their skills kind of fall off a cliff unless you do fellowship and you get better. So going through the motions doesn't work here.
Yeah.
You can't go through the motions. You need to be having deliberate practice and then going through these steps regularly, practicing. I love high fidelity simulations for this reason. And people get caught up in high fidelity simulations because they think it's all about the procedure. It's not. It's about the team. It's about the dynamics. It's about the critical thinking. It's about the critical assessment skills and how you interact together. Those are the goals here. We want to bring that stress level. We want to simulate that level of stress.
I think I've definitely seen a big change and shift in, at least from my experience and my ongoing and recurrent training, is that high fidelity simulation, putting us in through these impossible scenarios, right? And I'm always told that it was a real case. And I 1,000% believe that now. After, so many years, you're like,
nothing.
Initially, you're like, there's no way this would happen. And you're like, yeah, I could easily see where this would happen. Right.
Can't make this stuff up.
No. But when we talk about that role, right. And so how do we practice that? Like you said, with these high fidelity simulations, but the high fidelity simulation, like you said, it's about the team. So it's really the approaches. So how do we maintain and how do we train? How do we train that way to make sure we're hitting it and not just focusing on those skills, or whether you pass, fail, like the type of scenario. I mean, I know, where I'm at, there is no pass, fail. You go through it and you either do well or you don't, and that's okay. But you learn along the way, and then that self-reflection. And then I think what you said earlier, that the constraints of time, that the hindsight's always 20/20. So we do the debrief after the scenario, and I'm like, where the heck was I at? Where was I thinking with that? And I've tried really hard to set my mindset that each time I go through the simulation training, that I know that this is going to be tough. And I'm trying, and I still to this day still try. I go in September. I've got a couple months. I try to make sure that I have the right mindset going into it, but I know that I'm not going to be perfect. I want to be, I know that I'm not, but hopefully along the way, I'll achieve some type of excellence or, do that. But when we talk about that team training and that mindset for those high fidelity sims, how do you implement that type of practice?
Thank you to our sponsor, Precision Aviation Group. Mission-critical operators and fleet managers rely on Precision Aviation Group as a worldwide leading rotor and fixed-wing MRO provider. PAG provides tip-to-tail solutions in 4 MRO segments: avionics, components, engines, and manufacturing DER services. A single point of contact gives you access to over 150 million in inventory globally, 24/7. Just call 800-537-2778. Precision Aviation Group. Others sell parts. We sell support.
So that's the challenge. And a lot of it is getting to know your team members. I know Mike. Mike knows me. Mike knows how I perform. I know how Mike's going to perform. So knowing your team is one of the biggest parts of it. Understanding your personal performances. So part of knowing how to succeed as a team is knowing where a team's going to fail. And the good news is a whole bunch of studies have been done on this, a lot of it in the business world, but it's still applicable to us. I need to know how we're going to perform. I need to know my personal performance. I need to know my partner's personal performance. And I need to know how we are going to adapt to certain situations. And we've talked about adaptability a ton of times already, right? So you need to be able to adapt from one scenario to another. We need to be able to pivot. And I think when we were going through a lot of the initial changes when I first became the medical director, we had some leadership changes too. I think there was a going bet on how many times we would say pivot and adaptability in our staff meetings. And there might have been drinking games.
Cannot confirm nor deny.
Mike's having some flashback right now.
I can guarantee there was drinking games involved because I was on a couple of different texts. I'm like, guys, I'm here and I'm presenting on it. Like, Really? So other than adaptability, trust is incredibly important. I need to be able to trust you. You need to be able to trust me, especially in small teams and small group settings. I need to have that trust that if I ask someone to do something or someone asks me to do it, that I'm going to carry out that ask, that order, and it will be fulfilled. We will be successful in completing that objective. And we are in our, it's an interesting hybrid between the hospital-based model of medicine where it's, I hesitate to say this, but I'm going to anyway because I can, where it's more polite. Hey guys, is it okay? Such and such, can you do this? It's not super time sensitive, which is very different than when we're in procedural, high risk, high reward situations, which is more of a paramilitary style organization where see this, do this. It's not being disrespectful. It's not meant to go in a different way. It's I'm asking this because it's time sensitive. It has to be done. Just do it. And it's not.
So I have a question. Sorry.
Yes.
So about training, right? So as we're doing this, right? So when you're talking about you're relying on your partner, right? So I know where I'm at. We have the same amount of people assigned to our base, but I'm working with the same people, but just, differently, right? I might work with the same person twice that week. I might not work with that same person for a couple of weeks. And then just the way the schedules and everything rotates back. So I know when we go to do our annual training, they assign us just some complete rando. You're there with, 19 other people and you get some person that you are potentially meeting for the very first time, and
may or may not
I've
be
always
by design.
And I've had the love-hate with that, right? So because you quickly refine and learn very rapidly, because it's like, hey, here's your partner, you guys go. So you go to room 1 and you walk in and you're like, all right, well, I guess this is it. You get about a 30-second, hey, how you doing? And then you're in the sim, right? But then I know in the past when you've had a partner that you're training with that you've worked with hundreds of times, things can just kind of flow. So where's the over under on that? Is there a benefit to obviously the rando? Do you train better with the people that Like, so how do we approach that? And is there a right or wrong to that?
So I'm already opinionated on this because we just went through the failure parts of a team.
Right.
And an ad hoc team is inherently set up to fail. And we see that in the hospital situation all the time where you have ad hoc code teams and their performance is off. Who performs really well? Teams that train together. A small group of people who do this every single day together are going to outperform a group of randos who might have the individual skills that I put together. Right. So I would argue that your simulations are somewhat unrealistic and are almost setting you guys up for failure. Now, how do you overcome that? You're going to overcome it with overly communicating with someone. So closed loop communications and speaking through your plan. We see this in the ED in hospitals that have travelers where I might have someone I'm not used to working with and not used to running codes with, running peri-arrests and resusces with. And this is what the patient has. You're recapping. So you're giving someone, remember that step back. I'm stepping back. I'm giving that 10,000 foot overview. The whole room now knows what the overview is.
Right.
Now we're going to say what the patient has. So we're giving a pathology and then a treatment plan. And then I'm going to give individual tasks to individual people with closed loop communication when they're fed back. So overcoming the lack of teamwork and anticipation and knowing my partner by overly communicating.
Is there such thing as over communication? I think no, as long as it's relevant, I should say,
I would
like, oh, by the way, once we're done with this, we're going to get pizza. Right.
I've been guilty of that too.
Yeah.
But like pointing that out and saying, hey guys, like, cause it's no different than like I step on the ambulance, for the day and I've got someone I've never worked with before, but I always try to have that intro conversation. Hey, I'm Blake. Nice to meet you. I've probably met you before and I'm just losing my mind. So I apologize, but this is how I work. So I try to just kind of put that out there in the open in the beginning to break down those barriers or walls, because if we get into something, like you said, I just, you want to be as open and give that closed loop communication. That's like you said, I've always tried that. from my aspect, to try to see if that works. And I feel like I've had decent success with that. I don't know. I wish I could go and do my training with at least somebody I would know or routinely work with, because then I feel like you are able to, how do I say that? You're not comfortable, but you're confident in how you're going to get those things out. Like you can kind of work off of each other, how you go through it. Right.
But I kind of feel like, at least in my practice, whether it's a new partner I'm working with or whether it's a seasoned partner that I'm working with, and it's somebody that I find that we probably don't even need to talk on a call. We know what each other is doing the whole time. Like, I like that symbiotic working relationship, but I find in those calls and in my practice now, I still talk through every single thing out loud. My partners always know what's on my brain, what my concerns are, where I want to go with this patient, what my goals are. And at the same time, they share theirs so that we're all on the same page. And I feel like that not just like sets us up as a team for success, but it gives us a common goal that we're working towards. And it also allows me to mentally keep my thoughts organized by saying them out loud a little bit. Maybe it's just because I'm getting older and I'm having difficulty remembering things. But I feel like if I say it out loud, at least it seems to make a little bit more sense, or I can be like, no, that was stupid, and we're not going to do that. And so having those outward conversations, my partners always know what's on my mind. And so that's why I would tend to agree. Like, I don't think there's such a thing, as long as the communication is pertinent to what's going on with that particular patient or that particular scenario. I don't think there's such a thing as too much communication.
I really think that that's the key in those situations, Blake. It's breaking those, overcoming those barriers. That short pre-brief, even if it's 2 minutes, like, hey, I'm Garrett. This is my role. This is my job. This is what my background is. This is my communication style. These are my expectations. Setting those expectations immediately. You always should have some leeway sometime, even short of, I am driving to a call and there was a rollover of a bus full of nuns that just went down the ravine in front of me. Short of that, there's at least 2 seconds to do a pre-brief and get at least a partial 0-point survey in, so you can set those expectations that you can go from there.
And I think, in a lot of these concepts that we're talking about, you've talked about the planning of all of this stuff, right? And I'm just curious, in your opinion, how much of the mental rehearsal, if you will, plays into being successful as a resuscitationist?
I will answer that question with a different question to you guys. In terms of mental rehearsal, how close to actual track times are race car drivers? So to put another way, if a race car driver is going through mental rehearsals of driving a specific track, how long does their mental rehearsal take compared to their actual track times? Within 3 seconds, within 5 seconds, within a minute. How close do you think that is?
I'd say 30 seconds.
Yeah, so in that range of about 30 seconds for a full lap. So we're talking about 3+ minute lap times they're getting within 30 seconds.
Of their mental.
Of their mental rehearsal times.
Like the Thunderbirds and the Blue Angels, like those guys, when they start to practice and rehearse right before out, you watch some of those documentaries, they're eyes closed, they're all in the room and they're going through the motions in their mind of how they're going to do these procedure, how they're going to fly, how they're going to do this show.
So I was intentionally using a not aviation example, but let's use yours. So how close are the Blue Angels in terms of their mental rehearsals?
Oh, they've got to be 5 seconds, probably.
About 3.
Okay.
3 seconds of each other, eyes closed, going through everything together. And then when they use their props, they're less than a second off from each other.
Wow.
That's the type of mental rehearsal that we're talking about.
Yeah.
It's not just rehearsing your procedures. We're rehearsing how to do everything in real time with a perception of time. Because like we talked about before, your perception of time goes to absolute you-know-what.
Right.
Yeah.
So maintaining that rehearsal with that proper perception of time while we're going through procedures is incredibly important. How long is the laryngoscope in the mouth? How long are my hands off the chest? How long am I looking at the heart with ultrasound? How long is it taking me to actually administer blood? How long is it taking me to load the patient in the aircraft? Going through each one of these steps of a flight with mental rehearsals, including if things go astray. I can't tell you during training how frequently I was just sitting at home on the couch. The TV might be on, but I'm just walking through doing a crash central line. From palpating to cleaning and going through, and each time getting more efficient in my mind to the point where when I'm doing it physically, it's second nature. And that's what you're building here. You're building that muscle memory, but you're doing it through mental rehearsal. You don't even need to have the patient in front of you.
And I feel like, we probably all do a fair amount of that. Like, how many times like something didn't go well and now we're replaying all of those steps in our head again, and we're making sure that next time it is going to go well. Like, there's no other option but for it to go well next time. And I think we're all our own worst critics at times. So at least I hope that a lot of people are at least planning for that mental rehearsal and doing that mental rehearsal so that next time it seems a little bit more second nature, or that it doesn't feel as foreign, or that it's an easier process. And I think some of it goes along with the see one, do one, teach one models of things and how you're running through it. But I think that teaching aspect and being able to not just walk through it, but like verbalize each step by step and deliberately plan each course of that procedure. The more you do that along the way, whether you're teaching yourself or teaching someone else, the smoother it's going to be in the long run.
The other part of it is you can start introducing stress into that mental rehearsal as well. And different variations of it. So a great game that I love playing in the emergency department with my residents are, here's your patient. It's simple, it's straightforward. Now, I want to change X, Y, or Z, making it more complex, more stressful, more something, and then go through the mental rehearsal then. So you're using one, I'm going to call it tangible clinical example in front of you. And then you're taking that tangible example and then extrapolating that out to add different complexities so that if that were to happen later, or you're experiencing these different pathologies almost in real time, getting that inoculation, adding that stressful component to it. Hey, you've got this patient who was in unrestrained motorcycle collision, partial amputation of the left leg. Okay, perfect. We've got bleeding control with direct pressure somehow. This is another real case. Okay, now great. Now picture yourself in that situation. Now, what about if you didn't get proximal control with direct pressure? What's your next step? What's your next step? What's your next step? Mm-hmm. What access do you have? Now you're losing access. Where's your next access point? So going through that mental rehearsal, using that, hey, I was just on this. How can I make this as a real life as possible? So you're getting that physiologic response.
Thanks to our sponsor, Airbus. Airbus provides the most efficient helicopter solutions to its customers who serve, protect, save lives, and safely carry passengers in demanding environments. Its civil and military helicopters are flying all over the world, making missions possible. Visit airbus.com for more information.
And as you do that mental rehearsal, and like you said, as you introduce those stressors, are you essentially, I mean, you would think you're teaching yourself how to combat those stresses, or as they get introduced, but implementing it and doing those techniques, is there subtle differences between the mental rehearsal and then when it's actually happening? Obviously the real life stress is obviously going to be much more, but we try to play that back in our minds. How can we really focus on recognizing that we're getting to that stress point, and these other things are happening? How do we get to that point and combat those, or what techniques can we use to train ourselves to recognize that, try to mitigate it, and still move forward?
So recognition is a lot about self-awareness,
right?
Maintaining that self-awareness. And I struggle with this as well. I know I start to feel a true physical, and it's usually frustration in the emergency department, but I start feeling that I'm moving faster. I'm speaking faster. I'm starting to get a little sweaty. I mean, I cheat and I wear a watch that says what my heart rate is. So I'll see my heart rate's a little bit above my baseline. So I get the cues that I'm getting stressed. I'm starting to approach where I need to slow down and then I need to use some mitigation techniques. But it's self-awareness and self-recognition that you're getting to that spot. It's great when you're with a partner who recognizes these things. So like yesterday in the ED, as a good example, I had a CRAO, so a central retinal artery occlusion that we had to transfer emergently for hyperbarics because it's one of the only things I don't have is hyperbarics. And doing that at the same time, I had someone who was intubated, who was having some issues on the vent, and then trying to do a multimodal transport to get someone at it. So I felt myself starting to get a little stressed. I was hungry too. I missed lunch. And I was like, okay, I'm in a bad space right now. I just need 2 seconds. And of course, those 2 seconds, 4 people come up to you for something. You're like, give me a second. Which, I mean, I'll bring it up now because I think it's a great time. Dr. Mike Loria, he is over at University of Washington. He's one of their flight critical care medical directors, trained EM, critical resuscitation over at Stony Brook, then went back for surgical critical care, CVICU, but a former PJ. So he came up with a mnemonic called Beat the Stress Fool, which is more of a real time, because I know you were asking more about how do you understand and prepare yourself. And the self-awareness piece, to answer your question, is really something that you need to understand for yourself. And it takes practice to do. It's not easy. It's like people go for executive coaching to understand the self-awareness piece. Mm-hmm. It's a lot easier when you have a partner who can just be like, whack.
Yeah. Call you out on you. Call you out on your BS.
Yeah.
But I think the more important part of it is once you recognize it, what are you going to do about it? Once you're in that situation and things start to go awry, because we didn't talk about preparation, right? And I think the key to all of these things are make a plan, execute the plan. It's okay for you to adapt your plan. Adaptability is one of those core team concepts. It's one of those core individual recess concepts, business practice concepts, you name it, you have to be able to be adaptable. Military, same thing. However, once things start to go to you know where, and it's like literally spewing from every orifice, how am I going to mitigate that? And Mike Loria uses his mnemonic, it's Beat the Stress Fool, which BTSF. The breathe part is what works best for me. So it's breathe, talk, see, focus. Breathe works great for me. People call it different things: triangle breathing, square breathing, tactical breathing. I mean, I was always taught calling it tactical breathing, but I'm sure you guys have all used some variation of it. So I normally take a step back from the space. So I'm physically removing myself. Even though I'm still there, I might still be in the resuscitation. I'm not leaning on the bed. I'm taking a step back. And then I just do a standard box breathing breath hold, like in, hold 4 seconds, out 4 seconds, hold 4 seconds, in 4 seconds. And that enough will help stimulate your parasympathetic. So you're going to bring that heart rate down. I highly, highly do not recommend people who will take a deep breath, hold it, and vagal themselves. Please don't do that.
Not recommended.
I know like surgeons have been like, oh yeah, you get too stressed, you just take a deep breath and you just hold it and vagal yourself a little bit, bring that heart rate down to stop the shaking. Like, you do what in the operating room?
Yeah, just lock the knees while you're at it.
No, it's the wrong answer. But that box breathing alone will be enough to help stimulate those parasympathetics to help bring that heart rate down, bring that focus back in. I like that. That's usually what I use as my main part of this. The self-talk and self-affirmation. The self-talk, I don't think of it more as, hey, Garrett, I can do it. I view it as, this patient has this, this, and this. We've done this, this, and this. Here's a quick rehab. Our plan for the next 2 minutes is this, this, and these are the tasks. So I'm talking through the situation to reground the team, reground myself, and then say what our plan is going forward. And it gives the team tangible steps with associated outcomes that they can do. I need to have an IO placed in the left tibia. I need to have a right subclavian central line placed. It's a race for whoever gets it, and whoever gets it first gets the blood until we get better central access through that subclavian, anticipating someone's going to fail. But it's those clear micro steps that I'm giving them through talk. I mean, yeah, if you need to say like, Blake, I can do it. I am a very good flight clinician. That works too. Some people might give you some weird looks, but
I guarantee you Blake gives himself that pep talk every time.
I'm not going to say that it works, but it sounds cool.
And then the S is for that mental rehearsal that we went through ad nauseum, and then focus on trigger words as well. So that's when you're walking yourself through a procedure. So a great one for me for a more complex one is subclavians, where I'm entering the skin, I'm hitting bone, and I'm saying, okay, I've made contact with the clavicle. I'm pushing the needle under the clavicle and maintaining perpendicular, a parallel plane to the floor, perpendicular to the vessel. I'm entering the vessel. I've got flash. So I'm using those trigger words to remind me of those certain steps where in someone who's actively dying in front of you, you can lose yourself, but it regrounds you. So I like this mnemonic in a lot of ways, and props out to Mike Loria. Like, great guy. Love talking to him. Great to hang out with. Fun to drink with. But this was a really good mnemonic, at least as a whole, to discuss some preparatory as well as in the moment mitigation strategies.
I think again, first off is I think that self-awareness, but being able to, when you're in that high stress environment, to not just react to what's in front of you, and to use something like this to be able to take that step back and regain all of your thoughts and then have a different plan of attack. Because like you said, adaptability, like we do that every single day, every single mission we go on, there has to be some kind of adaptability. There has to be some give and take with all of that. And I think that as long as you're constantly doing that, whether it's the beat the stressful or you're doing some other variation where you're able to keep your brain in check and make sure that it's not spiraling, down a bad path, whatever that may be for you. I mean, certainly by all means go for it, but you have to be able to keep that mental portion of things like lined up, good to go, on the right track, or it's going to snowball really quickly.
Oh, and it can snowball real quick.
Yeah.
Being a junior resident at shock trauma was interesting the first one or two sick trauma recesses, and then going back year after year, and then being a senior, and then seeing how you run your recesses compared to originally.
Oh, for sure. I have no doubt, especially if there's any kind of video of those kind of things.
Oh, I love video recording ourselves doing recesses. We do it on our own trauma bay, and I wish there was a way that I could do it on the helicopter as well, so that we could show people. So that's how you actually were. You tell me how you think you were.
Right.
And then use that as a training tool. Just increase that self-awareness.
Well, the evidence shows.
Right.
That didn't happen well.
Yeah.
But that really goes into like the next big concept from these are, hey, it might not have gone well, but now we're debriefing, we're talking about it, and we're learning from it. I can't stress enough how important debriefs are.
100% on board with you there.
Blake, you guys debrief every call, I'm assuming.
Yeah. Depending on the complexity of the call, right? Your straightforward stroke. Hey, man, you did great with that cannula. That was awesome. I'm glad we got the end title right. but even so much
like a pro.
Yeah. But even so much as like, even on the mundane ones, as we call it, or routine, I should say, even just having that quick conversation, whether it was the operation of the flight, whether it was how we transitioned, the patient in and out of the aircraft to get inside the hospital. Maybe there was another aircraft coming in that we had to leave, or maybe we were like, you know what, this was straightforward, but man, I kind of thought that patient was like, he was starting to his mental status was starting to change a little bit, like I was kind of wondering, but then we were landing. So now it wasn't our problem anymore. We made it their problem, but that could have gone south. Right. Like, but those little critiques, right? Even up to the calls where nothing went right, you're flying back in scrubs, because your flight suit is destroyed. And you're like, well, that did not go as I had anticipated. But if we have to, we should be doing that, right? Because how else are we going to learn from just the trials? It doesn't have to be mistakes, right? But just like you pointed out, the communication. I think we identify a lot of times it's a process or something in that chain or breakdown. It's not that the person was not competent or confident and able to do something. It's normally a process or a lack of communication. But, we really try to make sure that we're at least debriefing some aspect of every flight, because like you said, the everybody has a plan until you get hit in the mouth, right? So like there's, and if it's something that I could clue into for next time, in the heat of the moment, that might stick back out as you're trying to talk through some things. So yeah, we definitely we do debrief after each flight. Wholeheartedly, it's not in depth for every flight, but we try to at least get something out of it.
I think when you talk about the debriefing process, I think that there's maybe even a piece that is, I don't want to say missing, but or maybe it's just not discussed. Maybe it's kind of the underlying tone, but there's certainly concepts of the team dynamics that I think can easily be identified within those debriefing processes that maybe are factors that are not allowing that team to be a cohesive unit, right? And so maybe nobody wants to say it, but maybe there's those things like they just don't trust each other, or maybe there was the communication breakdown like we talked about, or maybe there was some system things that were preventing them and causing roadblocks for them. And I think a lot of times, we go through the motions of a debrief, but we don't necessarily always talk about those more difficult topics that maybe we should be and advocating for having those more difficult conversations. I think that that's the only way that your team is going to grow and improve in these situations and being able to function in those high stress environments. But you have to be able to have those difficult conversations too. And how much, I was just curious, Garrett, like how much do you feel or what are debriefings like for you after those situations, or how much do you feel your teams have been able to grow after having those difficult conversations?
Thank you to our sponsor, Metro Aviation. Metro Aviation, the world's largest family-owned aeromedical operator, offers comprehensive aircraft services with 140 plus aircraft in over 25 states. The Completion Center installs medical and law enforcement kits and avionics, serving diverse aviation needs including offshore, utility, VIP, and corporate sectors.
And that's a loaded question a little bit because so it depends on the person and it depends on the team leader.
Yeah.
So in terms of debriefing styles, and both of you have talked on it a little bit, you've got debriefing with judgment. So you suck. I'm judging you. I'm saying you suck. There is a non-judgmental way on, I think the situation sucked. Or there's debriefing with good judgment on, there are specific pieces that we could have done better, which led to this outcome. So there's 3 different ways of debriefing. A good example, and I have no idea if we could actually do this or not, would be adding little clip of the Monsters Inc. when they were training the new guy and he fell on the sock and started going crazy around the room. And they immediately were like, you suck at this. And what did you do wrong? And he's like, oh, I landed on the side. I was like, no, you left the door open.
Yeah.
Complete wrong way to do a debriefing.
Right.
And on the flip side, then we have the Men in Black skit, which I love to show on these circumstances, where Will Smith is going in the shooting range and everyone opens fire on all of the monsters. And then he shoots little Sally in the head. He's like, Jay, what the hell happened? He's like, I hesitated. Because that's not the worst way of doing it, but he left a completely open-ended question. So there was no good judgment in there, rather than saying, why did you shoot, it's Tiffany. Why did you shoot little Tiffany in the head? Would have been a better question. So when you're going now to you keeping that in mind, what I just went through, to answer your question, how do I go into these situations? I go into it in a good judgment method of debriefing. So debrief with good judgment is the specific way that we talk about it in the sim world and the team dynamic world. So I'm being a realist about what went well, what didn't go well, but we're also doing it in a non-accusatory manner. So it's not saying, well, everything went to shit because such and such couldn't get the IV. We had multiple challenges with vascular access that ultimately led to this delay. What could we have done to overcome it? So I'm not saying, hey, the team failed because of this one individual person who did not have individual performance skills on. As a team, we succeed. As a team, we fail. If one individual person was failing, I failed as a leader to recognize that they were experiencing challenges, and I didn't do something to mitigate that. And as a team, you failed for not bringing it to my attention that we were failing or faltering in one different aspect of the team. So going into these situations and these debriefs and setting that expectation that, be honest. If I did something wrong, say I did something wrong. If you think someone else did something wrong, be professional about it, but we need to know. And then we need to bring it back to the team on how did we fail as a system? How did we succeed as a system? How as a system could we have adapted better to overcome the scenario? So you bring it back to that kind of root cause analysis, human performance structure on it's not an individual person, it's the system. And how could we have performed better?
Do you think there's a proper time frame? Some of these calls can be traumatic for everybody on the team, right? To see something, to experience something, to go through that. What is the proper time frame to do a proper debrief, right? So doing a deliberate debriefing process to make sure that we're all on the same page. You said you're not accusing anybody of doing one thing wrong in particular, right? You said we win as a team, we fail as a team. What's the good time frame to do a good proper debrief, especially if people went through a traumatic experience and someone saying, this is a lot for me to take in right now. And for us, clinicians that are, doing critical care and some of these, we're seeing typically these higher acuity patients. So we might be seeing some more of these really traumatic things more often. What if you need a couple days? Is there a good time frame to do this to where you don't lose the impact and the importance of the debrief process, but also the part of subjecting somebody to the repeated trauma mentally of replaying that and going over that? Is there a good time frame to go over that and still get the benefit?
To answer your question, there's very different ways that you need to approach some of these. In those more emotionally challenging cases, there's an initial hot wash with the crew. And it could be with the crew members to themselves saying that now we're not talking about the medicine at all. I'm not talking about, hey, this could have done better. This could have nothing to do with it. Are you okay?
Right.
Do you need a minute? I've had ones where I've just placed the aircraft out of service where I'm like, nope, you guys need a few minutes. Let me know when you're ready. Go get food. I'll order food and have it sent to a base. You guys need a few minutes. Take time. Yeah. So that's different than the formal and a more formalized debrief. Same thing with a little hot wash on this is what happened. Acknowledgement on our emotions. This is what happened. This is how I feel, because acknowledgement is one of those bigger things where if we just keep throwing it under the rug and we're pretending like it doesn't exist, it exists and it's going to affect our performance in some way. That is not the right time. That's not the right headspace to get in to do a formalized academic style debrief on what we could have done better.
Yeah.
And a lot of it's going to be a case by case basis. Sometimes it's like, hey, they're ready an hour or two later to talk about the case. Sometimes it's, hey, they need to process this for a few days. I hate pushing things out months.
Sure. Oh, absolutely.
I've pushed things off days. I pushed things off weeks.
I've just always found I get frustrated, I think, at times when there's always a push because people want to collect data, right? So they're like, we need to identify the processes. We need to figure out what went wrong, right? I'm all for that. Like we collect a whole lot of data, and we try to learn from that. But, like you said, there's got to be a good time and like, I guess, process, because if something was severely traumatic to a crew, to other people, to everybody that was involved in a resuscitation, right? The data can wait just a little bit, right? Because that data is there. It happened, it's on paper. We have it.
It's not going anywhere.
Right. So I feel like sometimes people are in such a pursuit to check a box just because somebody's telling them, hey, we need to check this box because we need to identify this, we need to close it out, and we need to move on. And I feel like that's such a management way of looking at things versus like we're clinical providers and we're dealing with real human emotions and real things. And, the mindset of a resuscitationist, right? There's a whole, like, you go through this whole process and you do this, but look at the long lasting effects, right? And then if you can't or address some of those things properly, what's going to happen when that provider is faced with another similar situation? That fear, controlling the fear, don't let the fear control you. And we talk about the mental rehearsal, like you're trying to do that over in your head, but then you get to that point where as the years go by, as you get more experience, and you have that, was it the Dunning-Kruger, effect? But I just feel like, I've seen just such a push at times for people that they just want to collect data. They want to check this box because they want to close it out with no other rhyme or reason to just do that because they want to get it off their plate and get on to the next one. Right. But we're all clinicians, and some of these things, not even from the trauma or the mental aspect of that. I mean, that is obviously the big part of it, but when people deal with those things and they go through it and they start to come down, if it's been a couple of days, or even a week, and you're like, all right, I've dealt with these feelings that I've had. I feel like now I'm in a good headspace to really receive the feedback and be accepting and not put up walls or go into a debrief thinking that you're like, well, that's your opinion. I did what I did. I feel like we have to really be better in how we do these debrief processes and making sure that everybody is, like you said, fully supported. We win as a team, we fail as a team, but I think we can do better than just checking a box and collecting the data. There's a whole art to that.
And that speaks to culture. Mike, you can talk to this because you do stress management, you do all of the response teams with Echo, the FAST team. I think it comes to program culture and leadership culture. At least from my incredibly biased opinion, I think we do a fairly good job at Lifeline doing this. And this was very deliberate on both my part, the part of our program manager, the rest of the leadership team, our senior providers, to create that safe space that is at least partially removed from the bureaucratic organizational piece that is most of healthcare, where they are striving for that Six Sigma, they're striving for that high reliability, or you're shaking because you know it, but at the same time they're losing.
I didn't think I would ever hear Six Sigma again in my life. That was so far gone.
Yep, and here we still are.
But that absolutely is the culture, and I think you have to approach it from a point of understanding from the get-go that everyone is there with the same goal in mind, and that's to treat our patients in the best way possible, to make sure that they're safe and that we're safe, and that we're conducting these missions with the same mindset, right? Like we're all working towards that common goal. And I think if you go into some of these debriefings with that understanding and with giving each other the benefit of that doubt that you are all there for the same task and the same goal in mind, and you start with that general respect level, I think that is where the debriefs can end up having that positive reinforcement and building those teams, and not just building those teams, but building those individuals. I think that understanding from the get-go allows people to do more inward reflection on their own personal performance and more outward reflection on the team's performance. That's just my personal take on it anyway.
Just to add, and by the way, I completely agree with you, to add another layer to that, I think it has the people doing the debrief, and especially when we're talking more and if things go poorly and we're talking about a root cause analysis, the people going through that with the team, they should be peers with similar background, coming from a clinical background, hopefully within the same environment. So I shouldn't have someone who has their MHA with no clinical experience whatsoever, who does system management, who's saying, why did this happen? What could you have done better? You need someone who is I've been in your shoes. I do your job. I still work clinically doing your job. What happened to you could have happened to me as easily as it happened to you.
Right.
And I would have made the exact same mistake that you would have made in this situation. And we're talking more RCA stuff and human performance analysis at this point. But what processes and systems failed, which led to this outcome? Not an individual thing. That's when we're talking about system level debriefs. We're debriefing you because you happened to be the poor SOB who it happened to. But it could have been the person on the shift before you, could have been on the shift after you. I could swap you out with pretty much almost any other provider who works in our program, and you just happen to be the unlucky person it happened to. And as long as you create a culture that is safe in that environment, that I'm assuming you did the right thing, and we're trying to figure out how to improve, that usually solves and creates a better psychological space for the team member. That is, quite frankly, every time they go through a debrief, every time they even close their eyes, they might be reliving that traumatic event.
100%.
And I want to make sure that we're supporting them through that event while also moving towards system level improvement.
Yeah, I think that's a really good point. And I think that we oftentimes forget about the human factor that's involved in a lot of these things. And I think that goes along with, we beat ourselves up over and over and over again. Every single one of us has those calls that we go through in our career that we can sit there and close our eyes and play back over and over and over again. And every time we do, it seems like the movie gets worse and worse. And, we beat ourselves up over and over again. I think that a lot of times in those debriefings, we forget about the fact that there is that human factor. There is those emotions and those feelings that go along with it. And I think that if you can approach it from a point of understanding or openness, that it certainly is going to be a lot better in the long run.
Completely agree.
Well, this has been an absolutely amazing discussion. Garrett, thank you so much for joining us today. I think that it's extremely important for us to at least have that self-awareness of our own mindset when we are put into these high-stress situations and how we can really affect the overall team dynamics, not just internally, but externally, whether we're working with just our own team or the teams around us. I certainly very much enjoyed the conversation. It's been one that's been something I couldn't wait to bring to the podcast ever since, we had our grand rounds a couple of weeks ago, and being able to have this discussion, because I think this is something that's so relevant to us and across the entire industry. So thank you, Garrett, so much. It's really been a pleasure having this discussion.
Thanks, guys. This has been a pleasure. It's been a ton of fun. And I mean, I already referenced some of the stuff, but huge shout out to the original people who kind of came up with this stuff, Cliff Reed, Mike Loria, and Scott Weingart. I have to definitely reference them as well. But guys, this was an absolute pleasure, and I hope to be on soon.
Thank you very much again. And if you guys do have any further questions or want to reach out to us, certainly give us a shout out here at the Valor Flight Crew podcast. We'll happily get you in touch with Garrett or anybody that would have more information for you. Thank you again, Garrett. Thank you, Blake. This has been a great discussion. And I'd also like to thank our listeners for the continued support of the Vertical Helicast platform and the Valor Flight Crew podcast. And we will see you next time. Have a good one, everyone. Thanks for joining us for this episode of the Valor Flight Crew podcast. Don't forget to like and subscribe to hear more stories that promote the personnel and equipment behind the missions in public safety aviation. Lastly, stand by for a message from our sponsors.
Thanks to our sponsor, Airbus. Airbus provides the most efficient helicopter solutions to its customers who serve, protect, save lives, and safely carry passengers in demanding environments. Its civil and military helicopters are flying all over the world, making missions possible. Visit airbus.com for more information.
Thank you to our sponsor, Metro Aviation. Metro Aviation, the world's largest family-owned aeromedical operator, offers comprehensive aircraft services with 140 plus aircraft in over 25 states. The Completion Center installs medical and law enforcement kits and avionics, serving diverse aviation needs including offshore, utility, VIP, and corporate sectors.
Thank you to our sponsor, Precision Aviation Group. Mission-critical operators and fleet managers rely on Precision Aviation Group as a worldwide leading rotor and fixed-wing MRO provider. PAG provides tip-to-tail solutions in 4 MRO segments: avionics, components, engines, and manufacturing DER services. A single point of contact gives you access to over 150 million in inventory globally, 24/7. Just call 800-537-2778. Precision Aviation Group. Others sell parts. We sell support.
That's a wrap on this episode of the Valor Flight Crew podcast. A big thanks to Dr. Garrett Cavaliere for bringing the heat and the insight on what it really takes to stay sharp in the high-stress world of critical care transport. If you took something away from this conversation, whether it's a mindset shift, a training tip, or just a reminder to breathe, be sure to share it with your crews. Remember, don't practice until you get it right. Practice until you can't get it wrong. We hope you enjoyed this conversation, and don't forget to subscribe, leave a review, and keep the conversation going with us on the socials. Until next time, stay ready, train deliberately, and be the calm in the chaos that our patients and crews depend on. Be safe, everyone, and we'll see you next week for another great conversation promoting the personnel and life-saving equipment behind helicopter air ambulance services.